Thanks very much. Indeed, it's my pleasure to be here and participate in this meeting. I've been in Taiwan a few times, and I really appreciate the invitation. Of course, I'm representing AASLD along with Anna, and hopefully we'll have a good interaction about having collaborative efforts between Taiwan and the American Association Study for Liver Diseases. That's actually one of the main goals of trying to have this kind of interaction and symposia. So, there are many icons here who know about hepatitis B more than I do. It's really a privilege and an honor to be part of this elite group. So I've been given this task of addressing the efforts around the world in eliminating hepatitis B. If you were to look at Taiwan as a model, you would think, well, it should not be that challenging, but you'll hopefully realize after I finish my talk that there are huge, huge, huge challenges in achieving this goal. So these are my disclosures. So you've already heard about the goals of elimination as set by WHO for hepatitis B and C, where they hope to have a significant impact by 2030, where there would be a 65% reduction in mortality, while there is an ambitious goal of a 90% reduction in new cases of hepatitis B, and that most would be targeted for therapy. So if you were to look at global surface antigen prevalence, it's around 4%. That corresponds to about 290 million people in the world infected with hepatitis B. This is as of 2016. It's quite a high prevalence overall. What we've noticed, though, is that there has been a decrease in prevalence of hepatitis B among younger individuals, those less than 5 years of age, and it's at about 1.4%. So I shouldn't say decrease, it's a lower rate of prevalence of surface antigen among the 5-year-old or lesser than 5 years of age. And undoubtedly, this is because of the impact of vaccination, which is a major step necessary towards elimination. Now, one thing we have not addressed well, or is not addressed well, is that there is an enormous cost that it'll have in terms of trying to achieve these goals. And here you can see the cost. It's actually on the y-axis you have in millions, so it actually goes into billions of dollars to try and achieve the goals of elimination of hepatitis B or hepatitis C. And that's where the challenge is. I think, in fact, that's a major challenge. The stakeholders are not readily forthcoming in terms of making the investment to try and achieve these goals. So this is some data that's been generated that looked at what it requires in terms of resources to achieve the goal of elimination, through, and this would be through universal health coverage. This modeling looked at 67 low and middle income countries where there are about 230 million infected individuals with hepatitis B and about 50 million with hepatitis C. And they looked at two resource investment strategies. One is of a progressive, scaled up resource investment, and then the other one is an ambitious upscaling of resources so that we could achieve the 2030 WHO goals. And you can see here, if you were to look at particularly ambitious, this is one, yeah, goal here, and you look at the y-axis, it's actually in billions of dollars. And then, of course, then if you really had the money, you would do the right monitoring use genetics to treat those infected, have an assessment, and then also do the appropriate serologic testing. But again, I want to point out that it's going to cost billions of dollars to achieve the WHO target. So then the strategy, the preventive strategy, while it's accomplished, is not simple. First, you need a 3-dose vaccination strategy, including a timely bird dose within 24 hours. And then those who are surface antigen positive, the mothers, you have to have a strong system to test and link to care. And then HBV, as been pointed out by Professor Chan, is required in some neonates. And then this is a supply issue. There is a cost issue, particularly in middle and low-income groups. And then during the third trimester, highly viremic mothers require hepatitis B therapy to decrease the risk of transmission to the neonates. So that's, again, another step required. In fact, it is just suboptimal in that area. And you need all of these strategies to effectively have an impact on prevention. Now, you all are familiar with Gavi. It's Global Alliance for Vaccination and Immunization, and it is a partnership between public sector and private sector. WHO, UNICEF are involved, and then even Bill Gates Foundation is involved in providing funding. And through this vaccination strategy, several people have been vaccinated. There's been an impact in several areas, and you can see here through this changing colors that more and more have been vaccinated through an approval process for vaccination through this, through Gavi. And there is an estimate of averting an estimated 4.8 million hepatitis B-related deaths by 2020. And in these areas, the support for hepatitis B birth dose vaccination beginning 2021. China, like Taiwan, has a good system in place to prevent transmission from mother to child and through effective vaccination. At one time, over 2 decades ago, there were quite a few people infected with hepatitis B, estimated 120 million people, and 60% had evidence of previous infection. And so through EPI, which is Expanded Program on Immunization, they integrated hepatitis B vaccine into the strategy, and then the goals were set at very high goals, 85% hepatitis B coverage in all counties, and then immunization was with auto-disabling syringes. And what you can see here, if you were to look at prevalence of surface antigen by age group at various time periods, 1979, 1992, and 2006, if you were to look at the green and the brown line, which represent 1979 and 1992, the young age population, you had quite high prevalence of surface antigen. But over time, in the more recent time period, around 2006, the young age population, there was a low rate of surface antigenemia. So clearly, they have had an impact, just like it's been shown in Taiwan. The coverage, the infant 3-dose coverage increased from 30 to 94%. Bird dose administration increased from 22 to 83%. So quite a nice model of preventing hepatitis B infection through vaccination. And among children less than 5 years of age, there was a 97% decline in surface antigen rate. Now, they looked at it in various areas of China, Western, Central, and Eastern region. And again, if you look at these over time, there's been quite a bit of an advancement in terms of hepatitis B immunization coverage, in that it's reached about 86% or higher at 2009. What is disappointing is that in some areas, despite access to pentavalent vaccine, the 3-dose coverage has been dropping, and this is here in Nigeria. And you can see from, there was a nice peak in 2009, 10, it was on a steady increase, but then subsequently it's dropped. And I'm not able to explain this, and I thought perhaps it's on the basis of the political climate that's going on there, and access may be a challenge there for those at risk to get the vaccination. But in certain parts, certainly it's not been a steady increase, but there's actually been a decrease in the coverage. Now, this is important data. If we were to look at 3-dose hepatitis B vaccine coverage, I will point out this is global, the black line, trend from 1995 onwards. If we were to look at America, that's been great. Look at a Western Pacific area, that's good as well, above the global average. And then Eastern Mediterranean area has done well. And again, but then if we were to look at Africa, it's really been poor. And Southeast Asia, more recently, it's close to the global average. One thing that we need to understand is Taiwan is one part of Asia, but there are lots of other countries that fall in the equation, and I'll demonstrate in a minute that if you were to look at Myanmar, the vaccination rate is very poor, and Myanmar is a huge country. You're a country of 23 million, and you're easily diluted amongst the rest of Asia when it comes to these statistics. Now, if you were to look at birth dose coverage, what is most alarming and disappointing is Africa. You can see over time, in 2015, it's really low rate of coverage and far below the global average. The Western Pacific theater has done very well, and America has done well. But what is the challenge is Africa. And this is one area that may have challenges that might perpetuate hepatitis B infection and negate any efforts towards meeting WHO goals by 2030. Now, if we were to look at the prevalence of hepatitis B in children under 5, around the world, it looks great. It's less than 1%. And that's the target at 2020. It's 0.8% of children under 5 globally have chronic hepatitis B infection. But what is, again, alarming is that if you were to look at Africa, it's about 2.3%. So this is one area where we need to have a lot of work, and certainly they are not on track to achieving the less than 1% target by 2020. Now, if we were to look at certain specific countries, it's estimated that about 20 countries will not reduce their surface antigen prevalence to less than 1% by 2020 and 0.1% by 2030 among 5-year-olds. And if you were to look at the countries there, while most of them are in Africa, there's some from Asia. Indonesia is listed there, along with Myanmar and even the Philippines. So right here in your neighborhood, you have quite a few countries with huge challenges in trying to decrease the prevalence of hepatitis B in those less than 5 years of age. So where do we stand with treatment? So prevention is one aspect, but we also need to treat patients to have an impact on the global status of hepatitis B infection. And what are the barriers? So if you were to look at number of people around the world who remain undiagnosed, 90% of hepatitis B patients remain undiagnosed, and 95% of treatment-eligible patients remain untreated. So that's a huge, huge number of people who are undiagnosed and untreated. And so if with this current trend globally, I don't believe we'll achieve the 2020 or 2030 targets for total diagnosed, treated, and individuals with reduction in liver-related mortality. And if you were to look at the Asian cascade of care, only about 2.2% have been treated. And if you look at global cascade of care, it's 1.6%. So again, Taiwan, good number of people may be treated, but if you look at Asia as a continent, relatively few people have been treated, and the number treated is, the percent treated is not far from the global treatment rates. So it's really scary and quite alarming. Now, the diagnosis and treatment rates depend on the income of a particular country. If you look at high income, relatively speaking, more are treated, about 24%. If you look at middle income countries, about 10% were treated. And if you look at low-income countries, it's only about 1% are treated. And then lower, in fact, this statistic, it says lower middle-income countries, so it's actually 0%. But actually, there are some treated, so it should be around 1%. So relatively low treatment rates based, and particularly in the low-income countries. So this is the upper middle-income countries, about 10%. High-income countries, about 24%. So if you were to look at certain regions of the world, Central Europe, you look at Greece, there are reasonable treatment rates, but if you look at sub-Saharan Africa, they're very abysmal treatment rates, it's less than 1%. So, what are some of the essentials for elimination of hepatitis B? We need to find a cure, and I presented some of the challenges, some of the potential advances that we might have. We need to reduce the cost. And then simplify treatment. We seem like we have a complex algorithm for identifying patients and treating those patients. And even a WHO guideline is not simple. It's rather complex. And this is challenging for someone to follow, say, in Western Africa, for instance. So it's just not practical. So something we need to think about it if we really have global elimination as high on our agenda. It's about 1.5% of all HBV infections are treated annually. However, given the complexity of the current guidelines, we should be grateful that anyone is treated. So if you were to look at some modeling and look at reduction of HBV incidence, to have the best impact, you would need to have infant vaccination in place, plus birth dose vaccination, plus peripartum treatment, and then obviously drugs that can cure. Even then, by 2050, we'll have a few cases of chronic HBV per year per million population. So we're not even close to this last step. We have, of course, in certain regions of the world, we've achieved infant vaccination. Birth dose vaccination is suboptimal in some regions. Peripartum treatment in those highly varying mothers is just evolving around the world, and it has a lot of catching up to do. And then We have drugs that suppress virus but not cure this infection. So there's several factors that will determine if a country will meet the elimination targets, but what is most important is political will. That remains the strongest predictor. And in low and middle income countries, the political will is not strong, from what I can gather. Of course, if treatment was provided free, yes, there would be an effort to upscale identifying patients and treating them, and also maximizing the vaccination strategies. So we need partnership of stakeholders, we need more healthcare providers, patient participation, and more importantly, governments to buy into the effort of elimination of hepatitis B. So it's your choice. Global elimination of hepatitis B by 2030, is it possible? Yes, no, maybe. Perhaps in Taiwan, maybe it's yes. In fair number of countries, and particularly a continent like Africa, I say no. And some other regions, maybe. So I am an optimist. I'm also someone who's cautiously optimistic about certain things. Yet, I think we have a big agenda and a lot of effort that we need to do to try and achieve this goal. So to summarize, hepatitis B is a large global health problem with largest burden in Asia and Africa and among persons from these regions. Transmission of hepatitis B and mortality are now targets for elimination. Certain countries and regions, say China, Western Pacific region, have developed exemplary hepatitis B prevention programs with virtual HBV elimination among vaccinated children. I didn't put in Taiwan because Professor Chen already talked about the great program that you have in China. No, Taiwan. And then, sorry. And then, obviously, vaccination has had a great impact. And then, globally, we really need urgent improvements in testing, care, and treatment to achieve elimination goals for mortality. I want to acknowledge John Ward and Homi Razavi for providing some guidance and providing some material so that I could make this presentation, because this is not what I do for my day-to-day activity. Thanks very much.